Hi, my name is Phil Carville. I'm one of the owners of the South Yuba Club, and I'm here today to talk about a service that I think could save your life. And I'm not fooling around. It could literally save your life. What I'm talking about is the CT heart scan provided by the Sierra Nevada Memorial Hospital, our local hospital and a great community asset. And the CT heart scan identifies possible plaque buildup, calcium deposits in your arteries surrounding your heart. And if that risk is there, you're at increased susceptibility to heart attack or stroke. And no one wants to be the recipient of a heart attack or stroke, which could possibly make you an invalid, dependent upon family and loved ones, and that's not a great situation. So the hospital and South Yuba Club have collaborated to provide this service at a discount to South Yuba Club members, $159 as opposed to $189. And I thought, well, if I'm going to urge my fellow members to take the CT scan, I ought to take it myself. So the rest of this video is about the scan.
We're pretty lucky to be able to live in the small towns of Grass Valley and Nevada City and even rural western Nevada County, and still have a great hospital for our health care. So let's visit the Diagnostic Imaging Center at the hospital and see what the CT scan is all about. The CT scanning equipment is located in the Diagnostic Center, which is incredibly modern and efficient. But before we go any farther, let's talk to Dr. Smith.
Hi, I'm Dr. Ryan Smith. I'm a board-certified cardiologist that treats cardiovascular diseases, as well as certified in the interpretation of CT scans of the heart. That allows you to get a very good idea if the arteries appear to be diseased and exactly how much calcium is building up around the arteries, how it compares to the arteries of somebody your age and gender. If we find a severe problem or even a moderate problem, we want to look into it more closely because we think that will give us a chance to address the problem, slow it down, and find out if it's really causing any blood flow abnormalities in the heart before it becomes a severe problem. What people might pay to have their engines in their cars tested on a regular basis, it would be far less than $200. If this engine fails, it will be a very severe problem for you and your family. And so I think it is very worthwhile to have the heart tested in this way.
I followed Dr. Smith's advice and I took the test. And you can see from the video it's easy and painless. But what I discovered was that I had been eating too much in the way of rich and fatty foods. I exercise a fair amount, but my diet really needed to change. And so that's the real benefit of this test, is that if you find out that you should be changing some things, at least you know quantitatively what the issues are, and now you can change your lifestyle or your diet or exercise more or whatever it takes. The neat thing is that you can lessen that risk of heart attack or stroke by getting a test, finding out where you are, and then changing your life. So if I can urge you to do two things: one, take the test; two, talk to your doctor about the results; and three, change your lifestyle. Come down to the South Yuba Club. We'll give you the programs based upon your doctor's recommendations that are going to work for you individually, and get out and live your life. Live it abundantly.